ambulance industry. There is no proper negotiation. It's a fixed price that you've got to take the ambulance in. And sometimes it becomes a very, very costly affair for a lot of our customers, a lot of our patients. So what we've decided, what we've incorporated into our app is basically ensuring that our customers are not stressed and not worried when it comes to pricing. So the biggest difference, which no other app in India, or I don't think anywhere in the world has, is negotiations. That's what we have launched today. So you as a customer is allowed to negotiate on the app and get a price which is absolutely pocket friendly and helps you get the ride that doesn't make you feel any worry or tension that am I going to be charged extra. So negotiations is the biggest feature that we've added, which is, I can guarantee, is different compared to any other app in the industry.
But how you are moving to the industry, especially you have only ambulances or you are
No, so we definitely work with aggregators. Like I said, the reason why we chose to have an asset light model, which is basically working as an aggregator, because I as an organization, I might be able to purchase 100 ambulances, 200 ambulances, but will that be able to cater to the need of helping a patient get an ambulance within 10 minutes? I don't think so, right? For that, I probably, at least in Hyderabad, I would need at least close to around 600, 700 ambulances, right? So that's the reason why we chose the asset light model, which is as an aggregator, because our tagline says racing to save lives. So when I have, like for example, this area where we are today, right? If there's a patient who's looking for an ambulance, we have service providers around this area who can reach the patient within 10 minutes to 15 minutes, right? So that's just why we work as an aggregator, and we do not have any ambulances of our own.
So coming to cost wise, so recently this first wave and second wave, ambulances owners are charging very high price. So how you are managing it?
So that's you. I could say this. Probably you will see that difference in our app. This, if once the, unfortunately the third wave hits, right? You will see the difference there, because the kind of understanding we've had with our service partners who are working with us, we've told them very clearly. So if you want to work with us, if you want to build your organization, if you want to build your business, the only way you can do that is if you're able to cater to customers' needs, right? So when you overcharge the customer might use you once, but will never use you again. Because why? You've charged the customer too much. But what we've done is we are ensuring our service partners charge a nominal rate, because we tell them, you charge a nominal rate, I can bring you more customers, right? So that's why that's one assurance we can say, that our rates will be lesser than any other provider that's coming with the ambulance services.
What are the basic price?
See, it depends. Like I said, there are a lot of factors that come into for a price. It could be obviously distance from X to Y. It could be what type of ambulance, what you need in the ambulance, all those factors. But I can tell you a simple example. If you take maybe a BLS, which is a basic life support, from say Begumpet to maybe KIMS Hospital, right? It would cost you anything between, if it's a basic life support, would not cost you more than 700, 800,000 rupees. And that's low, I can assure you that. There are a lot of providers who will charge you 3,000, 4,000, but we have it that
during
low.
the COVID times, we did face situations. During COVID, we did face such situations where, we had people crying on the call saying, they are charging me this much, I can't afford to pay, but my patient is critical, please help. So we understood the need of people in India to give them a rate which they can afford. So that is why we brought up this negotiation feature to help those kind of people. See, we need to understand India. The people in India starts from a lower to a higher background. It's not everybody who's high class. Even we need to cater to these people. In India, less than 10% people use ambulances. Why is that so? Why do people not want to take ambulances? Because of the price that some private sectors are charging. So that is what we want to cut. You cannot, people who are in stress, we need to help them. We cannot force a high price on those on that sector of people. So to help those people, we have come up with this negotiation feature. They will say their price, and we have that kind of an agreement with the service provider that they will be able, maybe there will be a 50 rupees or 100 rupees higher to give a reasonable. Now we cannot even tell the service providers you cut your pocket into it. It won't happen. So at a price which the service provider is happy, the customer is happy, and the ambulance is.
So coming to the time management, especially, is very important.
So